Definitely a few separate times where there have been tough situations and I've been able to walk into it gracefully and come out of it intact. It speaks very highly of how we're trained here.
I've been in this situation before. In a simulated and safe environment. I can do this.
Definitely that sense of like, I got this. It's fine, guys. I can do it.
From your perspective, what sets Pitt Med apart?
I think to me, the answer to that question is really simple, and it's the people. I see so much of kindness here, so much of empathy here.
The attention to teaching and the dedication to teaching that a lot of the clinical educators have, I think is really unique and really special.
When you start working on these projects with your mentors, you begin on pathways for these projects that kind of just take you to other connections and other data. Like you might find yourself like creating data that contributes to FDA approval for a new device, or working on retrospective studies with databases here that don't exist anywhere else.
I actually met with my mentor very recently, and I think it was so nice for me to see that it feels like the mentor is with me in this journey. It's rightfully said that Pitt Med is a research powerhouse. That is definitely the right term to use, but it's a meaningful powerhouse, and it's a powerhouse that makes you feel as though you're a part of a team. Because when I did meet with my mentor and we hit a roadblock, it wasn't just you, the MS1, hit a roadblock. It's we all have hit a roadblock. How can we move on from this roadblock together? I've done research in the past, but the research I'm doing right now feels particularly meaningful for that reason.
How do you think the curriculum is preparing you to be an excellent physician?
Because we have so much exposure to different types of hospitals between like children's hospitals and women's hospital that I think is really unique in terms of a medical school system that not a lot of other schools have access to. So you get so much exposure to like different specific populations and sort of how to navigate a large healthcare system in a city that's growing and changing. And I think that's really unique and sort of something I really appreciate as someone who's native to here and like to see how it's changing over time too.
To echo that, when you're a Pitt Med student that's finished the third year curriculum and then you go on away rotations to other institutions, you walk in the room and you are the resident and everyone around you is like, whoa. Because that's the expectation here. You're ready to take that step and start that learning process early. And when you're there somewhere else, you see how stark of a difference the Pitt Med education really is.
I already feel like I'm taking steps to be a better clinician based off of the way that we focus on clinical-based learning within our small groups. I've had longitudinal educators say that when I was an M1, I was not learning to think like this or think about the curriculum that you're experiencing in this way. You're consistently exposed to actual patients through the UPMC network. Even though I'm not a doctor yet, I'm definitely seeing steps that I'm taking towards that because of the way the preclinical curriculum is also oriented.
It's fantastic. Learning a lot here myself. So what about your life outside of the classroom and the clinic and the community?
Through the Longitudinal Alliance program, students are paired with a patient who has some kind of chronic health diagnosis, and they get the opportunity to follow that patient throughout the 4 years. Slowly, you start to kind of develop those clinical skills, and you start to better understand this person as a patient. But then you get to really maintain that human connection that you build with them very early on.
Fantastic.
I love that we don't just focus purely on the intellectual rigor and the research aspect of things, which are beautiful, but also the fact that we get to go and be a part of the community through Pitt Med.
Again, this comes back to the people, right? I knew that when I came here, I would need a place that I would feel supported, that I would find community, and I have found a multitude of both of those things. I remember when I was applying and I was looking for a place that was a home away from home. And in addition to that, you know, finding a place that's great academically, like it wasn't even a question really.
I would totally agree. Even though I'm so far from home, it does really feel like a home away from home, and that I have a family here, I have a support here, and I see myself consistently growing, and I see my classmates consistently growing. And that's why camaraderie comes so easy to us. That's why collaboration comes so easy to us. And that's why if you're thinking about coming to Pitt Med, just come. Like, you're gonna have a great time. I guarantee it for you. And you will find what you need professionally, intellectually, and personally.
My answer, I doubt it'll get recorded.